Congratulations on your new braces. This is an exciting step on your journey to a beautiful smile. It's completely normal to feel a bit of discomfort as you adjust to your braces, especially during the first few days. If you're feeling a little sore, you can take Tylenol as needed. If your parent prefers, you can even alternate between Tylenol and ibuprofen. We just ask that you don't stay in ibuprofen for more than a few days, as it can sometimes slow down tooth movement. In the bag we've given you, you're going to find a list of instructions. In here is a list of foods to avoid. This is really important for protecting your braces and keeping your treatment on track. Foods like hard apples, corn on the cob, toasted bagels, nuts, and hard pretzels should be avoided while wearing braces. Any foods that you need to bite into directly should be cut up into small bite-sized pieces. You'll also want to avoid chewing on ice, biting on your fingernails, or chewing on pens and pencils. These habits can easily damage your braces, leading to extra trips to our office and potentially slowing down tooth movement. Remember, the food list doesn't have everything on it. If something seems too hard or too sticky, it's probably best to avoid it. If you're ever unsure, just ask the parent. Now let's talk about the most important part, how to properly brush your teeth. This is crucial for preventing cavities and those permanent white spots that can form on your teeth if they're not cleaned properly. In your bag, you'll find a toothbrush. You can use a manual or an electric toothbrush. Just ensure it has soft bristles. Electric toothbrushes will not harm your braces, and we actually prefer them. So what you're going to do is start by brushing straight across the top of your braces. Get those bristles right above the brackets. Next, this is super important, focus on the gum line. You're going to make circles around, making sure you're cleaning all the areas above your braces and just below your lip. This is where a lot of plaque can build up, and it's the area many people miss. Then use the bristles to clean below the brackets and underneath the arch wire. Don't be afraid to really get those bristles in there. This is what will help you prevent those scars or permanent marks on your teeth once the braces come off. Once you've cleaned around all the braces, brush the inside surfaces of your teeth in a circular motion, just like you would without braces. Repeat all these steps for your bottom teeth. You should be brushing for a full 2 minutes at least twice a day. And remember, you can always brush more often. Always use a fluoride toothpaste when brushing, as this helps protect your teeth from cavities. The next tool you're going to find in your bag is called a proxy brush. It has a bendable head, which makes it easy to maneuver in between your braces. You'll use it to clean on either side of each bracket all the way around, at least once a day. Do the same for your bottom braces. Flossing with braces can be a bit of a challenge. This type of flosser is called a platypus flosser. It's our favorite type of flosser for braces because it can easily fit underneath your arch wire. Simply slide the flat, thin side of the flosser under the wire to effectively floss. You should floss once a day. Some patients also find a water flosser, often known as a water pick, to be really helpful for cleaning around their braces. It uses a stream of water to flush out food particles and plaque from hard-to-reach areas. The main goal of properly taking care of your teeth during orthodontic treatment is to protect your teeth from decalcification. Decalcification is essentially a permanent scar or white spot that can form on your tooth. The white is plaque buildup, and it's the first sign that decalcification is starting to form, so brushing thoroughly is incredibly important. Even with your braces, it's essential to continue seeing your general dentist for regular dental cleanings and checkups, typically every 6 months. They'll work closely with us to ensure your teeth stay healthy throughout your orthodontic treatment. In your bag, you're also going to find some wax. Wax is an excellent way for you to put something on your braces where it's rubbing your cheek or causing irritation. To get used to the wax, simply take a small piece and roll it into a ball, and then place it directly over the brace or wire that's bothering you. Gently squish it onto the tooth like this. It acts like a bumper, making it more comfortable and allowing your cheek to heal quickly. Another great tip for discomfort in your cheeks is to rinse with warm saltwater rinses. Mix a teaspoon of salt in a warm glass of water and swish around your mouth. This helps toughen up your cheeks and promotes faster healing for any irritations. Occasionally, a wire might start to poke you in the back. If this happens, you can try using the back of a proxy brush to gently push the wire back into the tube as much as possible, being careful not to apply too much force and break the bracket. If that doesn't work, this is a perfect time to use your orthodontic wax. If the wire is too long and you cannot be pushed back or covered with the wax, please call our office. It's common for something to break, especially during the first day or week with your new braces. After the first week, the odds of emergencies becomes very rare. A brace is either on or off. There's no in between. If something feels loose, it's considered broken. The brace might be sliding or spinning around the wire. If that happens, continue to brush well around the brace, but try not to play with it. Call our office and we can schedule an appointment to get it repaired. If you play any sports, a mouth guard will be your best friend. You must use a mouth guard if you play any contact sports like football, hockey, or lacrosse. Make sure it's a braces-friendly mouth guard like a shock doctor. Never use a boil and bite mouth guard when you braces, as it can get stuck and damage your appliances. Also, never play with your mouth guard or chew on any part of it, as this can lead to breakage and another trip back to our office. We're so excited for you to begin this journey to a beautiful, healthy smile. If you have any questions or concerns, please don't hesitate to reach out to our office. We're here to help you every step of the way.